I'm with Dr. Victor Reyes, a board-certified family practitioner, and today we're going to talk about allergies. And I know when allergy season strikes, it can be miserable for some people. Symptoms vary. What are the typical symptoms of allergies?
Most people who suffer from allergies are usually going to get what they usually describe as hay fever. So it'll usually be runny nose, stuffy nose, itchy eyes, a lot of postnasal drip. Some people may end up finding their asthma getting worse if they have asthma, but the usual thing will be more the hay fever symptoms.
When is it time to consult a physician?
Well, most people with allergies don't have to consult a physician. They just have to be careful and pay attention. If in fact it is actually something that happens to them in springtime, then they should be aware that they're probably reacting to the pollen from the trees outside that are starting to bloom. If they can control things by avoiding the pollen, that's the key, is simply avoiding what you're allergic to. Now, you can't really avoid pollen when you're outside, but what you want to do is make your home your safe place. So I'll advise people to keep their windows and doors closed at all times, which they don't want to do because it's springtime and they want to let in a nice, wonderful spring breeze, but along with the breeze comes in all the pollen, and that's the enemy. They need to keep that outside. So keeping the pollen outside is the first important part. The second part would be they could certainly consider using any one of a number of non-drowsy antihistamines, whether that would be Zyrtec or Claritin or Allegra, which are all now available generically, so they're not very expensive at all. And those, along with keeping the windows and doors closed, are usually enough for most patients. If that's not enough, that's the time then when you want to consider seeing your doctor.
Are seasonal allergies typically in the spring, or do they occur at other times of the year?
Seasonal allergies require seasons. This is Southern California. We don't really have real seasons. Our seasons tend to all mesh together, but for the most part, the main time for people for allergies that are seasonal will be in the spring when the trees first begin to bloom. As the months go on, the grasses then become the major pollen source, and then eventually the weeds. And then when we hit winter, pollen counts tend to be rather low. But for most people, the worst time of the year will be spring with the trees in bloom.
And then is there an average time of when you're affected? I mean, can most people know that 3 weeks you're done or 4 weeks you're done, or does it just vary from person to person?
If it is really someone who is allergic to trees, they're usually going to notice symptoms in Southern California starting probably around late February. The miserable months are going to be April and May, and then by the time we get to June, all the trees are pretty much in full leaf and the pollen counts drop down. So that will be the bad time. It's usually April and May will be the worst.